Salmon Oil-1000 is a supplement that contains omega-3 fatty acids, which are believed to help lower the risk of heart disease. It can also be used to lower triglyceride levels and increase HDL cholesterol when combined with a healthy diet and exercise. It's important to be cautious of potentially harmful impurities or additives in some supplement products, so it's recommended to consult with your pharmacist for more information about the specific brand you are using. Keep in mind that the U.S. Food and Drug Administration has not evaluated the safety or effectiveness of this product, so it's best to talk to your doctor or pharmacist for further guidance. The recommended daily dosage of Salmon Oil-1000 may vary depending on individual needs, but it's generally suggested to take it with meals for better absorption. It is best to take it at the same time each day to establish a routine for consistency. When taking Salmon Oil-1000, it's important to follow the instructions on the package label. If you have any questions, be sure to ask your doctor or pharmacist for guidance. If you're using the enteric-coated capsules, make sure to swallow them whole. For the chewable form, be sure to chew thoroughly before swallowing. And if you're using the liquid form, it's important to measure the dose carefully with a special measuring device/spoon. Do not use a household spoon as it may not give you the correct dose. Some brands of this medication should be shaken well before each use. If your condition doesn't improve or gets worse, or if you think you may have a serious medical problem, it's important to seek medical help right away. Some possible side effects of taking Salmon Oil-1000 include a fishy aftertaste, nausea, bloating, or burping. If any of these effects persist or worsen, it's important to speak with your doctor or pharmacist. If your doctor has recommended this product, it's because they believe the benefits outweigh the potential risks of side effects. Most people who use this medication do not experience serious side effects. However, it's crucial to contact your doctor immediately if you notice any serious side effects, such as easy bleeding or bruising. While rare, a very serious allergic reaction to Salmon Oil-1000 can occur. Seek medical help immediately if you experience symptoms such as rash, itching, swelling, especially of the face, tongue, or throat, severe dizziness, or difficulty breathing. It's important to note that this is not a complete list of possible side effects. If you notice any other effects not mentioned here, be sure to contact your doctor or pharmacist for further guidance. If you are in the U.S., you can call your doctor for medical advice about side effects, or report them to the FDA at 1-800-FDA-1088 or www.fda.gov/medwatch. In Canada, you can call your doctor for medical advice about side effects, or report them to Health Canada at 1-866-234-2345. Before taking Salmon Oil-1000, make sure to let your doctor or pharmacist know if you're allergic to omega-3 fatty acids, fish, or any other allergies. This product may contain inactive ingredients that can cause allergic reactions, so it's important to talk to your pharmacist for more details. If you're pregnant, it's best to use this medication only when necessary and discuss the risks and benefits with your doctor. It's also important to consult your doctor before taking this product if you are breastfeeding, as it is unknown if it passes into breast milk. As for the daily dosage and optimal timing, talk to your doctor for personalized recommendations. When taking Salmon Oil-1000, it's important to be aware of any potential drug interactions. This means that the way your medications work or the risk of serious side effects could be affected. It's a good idea to keep a list of all the products you use, including any prescription or non-prescription drugs, as well as any herbal products, and share this information with your doctor and pharmacist. It's important to always consult with your doctor before starting, stopping, or changing the dosage of any medicines. This will help ensure the safe and effective use of Salmon Oil-1000. If someone has taken too much Salmon Oil-1000 and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical attention. In the U.S., you can call your local poison control center at 1-800-222-1222, and in Canada, you can call a provincial poison control center for assistance. Remember to keep up with your doctor appointments and any necessary medical tests while taking Salmon Oil-1000. Your doctor may want to monitor your cholesterol levels and liver function to ensure that the medication is working effectively for you. Be sure to consult with your doctor for more information on how to manage these tests. As always, it's important to follow your doctor's instructions and recommendations. If you forget to take your Salmon Oil-1000, take it as soon as you remember. But if it's almost time for your next dose, just skip the missed one. Don't take double doses to make up for it. Remember to take your next dose at the regular time. When it comes to storing Salmon Oil-1000, it's important to follow the instructions on the package. Keep it away from light and moisture, and definitely don't store it in the bathroom or freeze it. And, as with all medications, keep it out of reach of children and pets. When it comes to getting rid of any unused or expired Salmon Oil-1000, don't just flush it down the toilet or pour it down the drain. Instead, it's best to properly discard it. You can ask your pharmacist for advice on how to do this, or check with your local waste disposal company for the best way to dispose of it. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.